What's up, guys? We're going to talk about the weak links of the squat. So, what muscles might be your limiting factor based on where you're experiencing a sticking point or maybe constantly failing the lift. So, we'll talk about the quads first. The quads are usually stressed the most in that deep range position. So, if you feel like your sticking point is in this deep range or you're constantly failing at that very bottom position, might be indicating weak quads relative to your strong low back. If you feel like you get out of that position, it becomes a lot easier to get the weight up. Also, if you have a tendency to kind of get pitched forward in this good morning style squat, so very exaggerated forward lean here, if you get into this position and you feel like you can actually muscle the weight up, and if you complete the lift, this could mean that your back is actually relatively strong compared to your quads. So your quads are kind of shifting the force and the torque to work towards your spinal erectors, so because they're stronger and they can get the weight up. So if you get into this position and you feel like you do complete it, that might be indicating that you have a strong low back relative to weak quads. Also, if there are large differences in your squat 1 rep max and your conventional deadlift 1 rep max, this could also indicate weak quads relative to a strong low back. So this is a table of some normative data of IPF competitors, so some powerlifters based on their weight class. So we can kind of look at the average numbers and ratios here. So let's say 88% is the average ratio. If your squat is 88% of your conventional deadlift, that would be a normal ratio to have. So if you feel like there are large differences between the two, your squat maybe is 80% of your conventional deadlift, then that might indicate that you have weak quads relative to a strong low back. Also, leverages obviously play a part in this, and your body proportions and things like that. But regardless, if it's due to leverages or a weakness, it's still kind of important to identify what we need to train more than other things. So that's what those ratios would indicate. Let's talk about the low back next. So if you're failing the lift kind of slightly above parallel, or you're experiencing the sticking point slightly above parallel, kind of in this range right here, it's more indicative of a low back weakness. This is probably the more common limiting factor of the two, and can also result in this good morning style squat position. But in this case, when you get into this position with an exaggerated forward lean, you can't use your low back strength because your low back might be the weakness. So if you get into this slightly pitched forward position and fail the lift, this might be indicating a low back weakness. We talked about before that if you get in this position and muscle the weight up, it would mean the opposite, weak quads relative to a strong low back. In this case, you're getting into this position but are failing the lift because your spinal erectors can't really muscle the weight up like before. This could also be identified with larger differences in your squat 1 rep max to your deadlift 1 rep max, like we talked about. A big conventional deadlift 1 rep max compared to your squat might show that your low back is a lot stronger. So how would we target these muscles and positions that we find are our weak link? So if we're talking about out of the hole or a quad weakness, we would just do more quad dominant squatting. So something like a hack squat or even a leg press with a lower foot placement would target the quads a little bit more. Front squats, high bar squats, or just adding heel elevation to any type of squat variation could also target the quads a little bit better. Just lets the knees track forward a little bit more and puts more stress on the knee extensors and the quads. So those would be good options. Pause squatting in the hole. So doing pause squats in that sticking point, obviously you got to use a little bit lighter weight for this, would be a really good option. It directly targets that range and that position that you might be weakened. And obviously just isolation exercises like knee extensions. Obviously people don't really think about knee extensions as helping your squat increase, but having more muscle mass in that area, especially incorporating the extensions in like a hypertrophy block or something like that, would be beneficial just to put more muscle mass on those quads. If we're talking about slightly above parallel or a low back weakness, then we would just do more hinge dominant movements. So something like Romanian deadlifts, good mornings, or conventional deadlifts would be really good to target the low back. Obviously your glutes and your hammies get worked in those movements too. And side note, glutes and hammies are obviously important in these movements, but are usually not the limiting factor when it comes to squatting. Also, pause squatting slightly above parallel but on the way up. So kind of completing the full descent into the hole and then coming out of the hole a few inches and then pausing when you're in that sticking point. Again, you got to use lighter weight for this. That could be a really good accessory exercise as well. And isolation exercise to target the spinal erectors like back raises or reverse hypers, just to put, again, more muscle mass in that area will always be beneficial. Other than that, that's pretty much it. Please let me know if you have any questions or if you have any idea of any small topic that we talked about in this video that you want to see in a future video. Let me know. Other than that, that's the video. I hope you enjoyed.